I'd like to thank you for joining us for our Doula 101 webinar, Health and Joyous Births Take a Village. This webinar is a collaboration between the LA County Department of Public Health's African American Infant and Maternal Mortality Program, which is the AAIMM program, and the African American Home Visiting Engagement Workgroup of the Consortium. During this webinar, you will learn about the importance of doula care, how to help your clients access doula services offered in LA County through the Medi-Cal doula benefit, and the importance of providing culturally affirming support to birthing families. Please join me in welcoming our two speakers, Helen O'Connor and Ashley Skiffer-Thompson. Helen is a health program analyst for the LA County Department of Public Health, Maternal, Child, and Adolescent Health Division, which stands for the MCAH. Since 2018, she has co-led the African American Infant and Maternal Mortality Prevention Initiative, which is the AAIMM, to expose and eliminate perinatal health disparities that are results of social inequity. In this role, she oversees the AAIMM doula programs, the fatherhood program, and the AAIMM steering committee, and a range of perinatal equity projects. Ashley, in addition to serving as a co-lead for the African American Home Visiting Engagement Workgroup of the Consortium, is the program coordinator for the AAIMM doula program, and is committed to giving back to her community. She has spent majority of her career
Oh, Siobhan, you got muted.
I'll start over, I'm sorry.
There we go.
Ashley, in addition to serving as a co-lead for the African American Home Visiting Engagement Workgroup of the Consortium, is the program coordinator for the AAIMM doula program and is committed to giving back to her community. She has spent majority of her career in the nonprofit sector within the home visitation field, gaining experiences in breastfeeding, bonding attachment, and other maternal and child health topics. As a full spectrum doula, she believes there is empowerment through advocacy and education. By providing empathetic support and encouraging medical advocacy, her hope is that families feel empowered, grounded, and valued throughout the birth journey. We invite you to actively participate and ask questions throughout the presentation and ask that you complete a brief evaluation at the end of the webinar. Without further ado, please welcome Helen and Ashley to the virtual stage. Thank you, Siobhan. Can we go to the next slide?
Ooh, Ashley, it's hard to hear you.
How about that?
Well, I'll do this slide and we'll work on that. Otherwise, good afternoon, everyone, and I'm sorry if you end up hearing a lot from me and less from Ashley. It's a pleasure to be with all of you this afternoon. Just wanted to, before we hop into doulas, wanted to give an overview of all that's going on at the Department of Public Health in our Division of Maternal, Child, and Adolescent Health. We have open doors to health and support, as it says, and most of you are probably extremely familiar with DPH because we fund so many home visiting services alongside First 5 LA. And collaborate on many projects with the consortium. So for most of you, perhaps this is not new information, but I wanted to share what is available to your clients through the Department of Public Health, and Ashley and I are always here to be that help with a warm handoff clients to any of these services. So in addition to home visiting, we have all of the services under the AIM initiative. And for Siobhan, we just say AIM because saying AAIMM every time we wouldn't get anything else done in the day. So we just say AIM. We have our doula program, fatherhood program, We're also working in the jail with incarcerated pregnant folks, and have a number of provider trainings, policy work that we do through AIM. In addition, at MCAH, we have the Black Infant Health Program. We have Help Me Grow, which is our early identification and intervention program for children. We help with Medi-Cal enrollment. We have resources for families that have experienced loss, the SIDS or SUIDS loss. We work with youth through the Positive Youth Development Program. We have an asthma prevention coalition, which folks are all welcome to join. We do lead poisoning prevention, and have our clinical arm through Comprehensive Perinatal Services Program, CPSP. So this is just to say, we're here to talk about doulas and home visiting and how there can be beautiful collaboration there, but there are a lot of additional opportunities for us to collaborate. So holler if anything looks exciting to you. You can go to the next slide, please. Okay, Ashley, let's see.
Let's see, can you all hear me?
Beautiful.
All right, the game. Okay, so as Siobhan mentioned before, our objectives today are to inform participants on the AIM Prevention Initiative and supporting Black birth equity efforts, educate participants on the importance of doula care, Los Angeles County doula resources, and the Medi-Cal doula benefit. In addition, increase participants' knowledge on how to support, promote, encourage, and welcome doulas to strengthen the birth team. And lastly, inspire participants to engage in community-led collaborative efforts to promote culturally affirming support to birthing families. Next slide. And so to get us started, we just want to do a couple of polls to see where everyone is with their knowledge of doula support. So we'll pull that up now. And Anna, are we able to see the results afterwards?
Yes, I think you should be able to see it live right now. Is the information not popping up on your screen?
I just saw the first question and I answered it and it went away.
Okay, perfect. I'll publish it as soon as I end the poll then.
Thank you.
Mm-hmm. I'll give it a few more seconds for folks to answer and then I'll close it. Thank you everyone for participating.
And maybe we can read out the question. So I don't know if there are people who have just joined by phone. They can yell out their answer.
Yes, our first question is, how familiar are you with what a doula scope is?
Okay, we have a range.
Yep.
We have some that are not, a lot that are not familiar, some in between. And a few answers. I think I'm probably the only one that answered 5. And Ellen. Thank you. We can go to the next polling question.
The second question asks, are you familiar with the Medi-Cal doula benefit? Give it a few more seconds before I close it out.
All right, we have majority answering no with 69% and 31 answering yeah. Over here, hopefully that number increases by the end of the presentation.
We can actually save this question for later. Thanks, Anna.
Sorry about that. It must have been out of order for me, but this question asks, are you interested in learning about future trainings to become a doula?
Well, that's exciting to see.
And then I think we have one more for clients. Let me launch the last question and then I'll hand it back to you guys. The fourth and final question asks, do you have clients who have access to Medi-Cal benefit?
That is progress. 39% answering yes, interested but not yet access, 2%, no with 20, and don't know for 39%. So this is great. This is great to get this feedback from you all. Next slide. So this is why we're here. So some of you hold that you aren't as familiar with doula support. So we'll be sharing just a little bit in what that means. So what is a doula? Doulas are trained childbirth helpers, support persons that provide clients physical and emotional support, but also education, advocacy throughout pregnancy, labor and birth, but the postpartum period. Doulas are also, you'll hear the term full spectrum doulas, and those are doulas that support all pregnancy and birth outcomes, including abortion, termination, and fetal loss, miscarriages, as well as maternal losses. So we are definitely full spectrum in the support that we can provide. And evidence has shown that continuous doula support can decrease maternal deaths, preterm risks of cesarean, use of pain medication and labor augmentation, such as inductions, length of labor, but also increase the chances of spontaneous vaginal birth, breastfeeding initiation and duration, and just overall experience, overall satisfaction with their birth experience. And so we recognize that doulas are part of this to ensure that families are having healthy, joyous, celebratory births. Next slide. And so we wanted to ground you all in some data to bring home how important merging doula services with home visiting services as well as complementary and a collaborative effort. So we have some data here that about 76% of home visiting clients are receiving Medi-Cal as their primary insurance. And this data is from fiscal year 2022 and 23 for our first 5 funded home visiting programs. So Welcome Baby, Healthy Families America, and Parents as Teachers. We also wanted to look at the California Listening to Mothers survey and ground you all in that data that shared that California Listening Mothers respondents reported interest or consideration of a doula for support for their next birth, and that's 56%, but that number jumps to 66% when reporting from Black birthing families. And then lastly, 55% of respondents from the California Listening to Mothers survey reported that their interest for having doula support, they were receiving Medi-Cal as their primary insurance. So there's definitely a high interest, high need for doula services, in particular to Medi-Cal beneficiaries. Next slide. And so we want to share a little bit about doulas and their scope of work. So oftentimes we hear like, how is a doula different from a midwife? And so I always say that doulas handle everything from the waist up, and midwives and doctors handle everything from the waist down. So doulas are not medical professionals. We don't perform any clinical tasks such as vaginal monitoring, fetal heart monitoring. We do not give medical advice to our clients. Also, we don't make decisions for our clients, medical or otherwise. So oftentimes when people think of doulas, they think about natural births, home births, but doulas are there to support families in their birthing choices and to make them feel empowered and supported throughout that journey. So we don't pressure the birthing person into certain choices just because the doula may have a preference. We're really being able to talk about all of the decision family in that journey and moment. Also, we don't take over the role of the parent, support person, or family member. Doulas are there for the entire family. So being able to strengthen that birthing team, doulas are often mothers, partners, grandmothers, aunts to join in prenatal sessions so that they're able to be on the same page and understand all of the different outcomes, interventions, and feel informed and choices. Next slide. So while we talk about what doulas don't do, here are some things that doulas do. So we do provide physical and emotional support. So what that can look like prenatally is just holding space for the birthing person, discussing their fears, their past experiences, really talking through what that journey looks like, going over prenatal appointments, what to ask out with your medical provider. And then some things that are done prenatally is going over comfort measures. So what do you need in the moment to make you feel comfortable in your birth as much as you can during birth? So going over different labor positions to help labor progress, walking with families, talking about nutrition, just holding space for them to share their birth experience postpartum, and really focusing on not only the family, but in particular the birthing person and their postpartum recovery and what that looks like. So sometimes prenatally, doulas will do what we call postpartum planning. So, okay, what does that first 2 weeks look like? And if you have support, what does that support look like? So if aunt, cousin, family, friend wants to stop by and see the baby, maybe asking them for tangible things that they can do for you that you feel supported and you're not just hosting and have to get out of that recovery mode or that bubble. So asking, okay, if you're coming by to see the baby, I'm actually going to rest. Or can you come by and bring some food for the family, or some water, or just some light dishes? So those are some of the things that doulas do postpartumly, some basic household tasks. Really want to focus on making sure that birthing person and that family feel supported in tangible ways. So we help families also assist with fully understanding their options. So one of the things that I particularly am passionate about is medical advocacy and what that looks like. So you're fully informed of your choices. So going over the different medical interventions. And one of the tools that we use is called BRAIN. So talking about what are the benefits of this intervention? How can it positively impact me, my baby, and my labor? What are some of the risks that will negatively impact me, my baby, or my labor? What are the alternatives? And we really hone in on I, which is what is your intuition telling you, and what's coming up, what's your gut feeling around the options that are being provided to you at the moment. And then N, which is what if we need more time or do nothing. So really, again, ensuring that families feel confident, feel informed in the decisions that they're making. And so it's a more empowering and joyous journey. We also provide evidence-based education, again, going into those medical interventions, nutrition, being able to talk with them fully through that. So going over the stages of labor, when you're in active labor, doulas usually start to support a client when they're in active labor. So that is 5 centimeters. But we also support cesareans, depending on the client's choice. Then we're able to go in because one person in for cesarean births. And talking with that about with the clients and letting them know. We also provide breastfeeding education, but also maternal and mental health education and support, making sure they're doing well throughout their journey, perinatal journey, but also postpartum as well. And then again, that support is supporting the birthing team, including fathers, partners, whoever the birthing person has identified as their support, encouraging those folks to join in those prenatal sessions. And again, I spoke to it already, which is postpartum planning and support. Next slide. And so we are going to talk a little bit about the AIM Prevention Initiative. So it's African American Infant and Maternal Mortality Prevention Initiative. And we recognize that it is racism that was causing the disproportionate rates of infant and maternal mortality in the Black community. And so 4 ways to address this is through our strategies of reducing threats to health, and social stressors. So one thing is identifying and making the community aware of this disparity. And we've done this in a way that's come from a strength-based approach because it can be daunting looking at those statistics. So it started with 400 years is enough to activate the village, be the village, and now in 2023, grow the village. Also, we recognize that there are other social stressors that come along with the disparity and just racism and the physiological toll that it takes on Black birthing bodies. So we also address this with talking about paid family leave, support around earned income credit, guaranteed income, and then at a higher level of policy and advocacy. Second strategy is improving health stressors. So direct service like the AIM doula program that I coordinate, where we offer free doula to Black birthing families in Los Angeles County. We also are a collaboration of community-led organizations. So partnering with trusted resources in the community like Black Maternal Health Center of Excellence, who provide group prenatal care, discussing preconception healthcare, as well as our fatherhood engagement and support facilitated by our fatherhood coordinator, Davion Malden. where he's able to meet with expecting fathers weekly to where they create a birth plan. They go over the stages of labor. They go over postpartum planning and newborn care and what that looks like from a fatherhood standpoint. And they're being informed of the same information that our birthing clients are being provided. Third, we have provide healthcare designed to avert consequences of stresses. So we have our hospital perinatal quality improvement, which some of you may know as Cherished Futures for Black babies and moms, which will be sunsetting at the end of the year, but also focusing on clinical prevention, preterm birth, but also pregnancy intent provider trainings and screenings facilitated through our PI initiative. And lastly, we support collaborative structures in local and county levels. So we have a steering committee composed of Black-led organizations and leaders that have been doing the work and continue to do the work. So we stand on their shoulders for organizations like Black Women for Wellness, I Dream for Racial Health Equity, and many more. We have our community action team. So if you hear something in the background, it's the end of the year celebration, where we're across Los Angeles County in 4 of the different spas, including South LA, South Bay, Antelope Valley, Santa Clarita, as well as San Gabriel. And then lastly, we have our AIM Village Fund, where we buy philanthropic funds, all organizations that are aligned with our mission with the Prevention Initiative. Next slide. And now we'll do a program highlight of our AIM Doula program.
Hey, Lorna.
Hi, Nikki. How are you?
Good. How are you?
I'm good. My name is Lorna Leverett. I am a community doula for the AIM Doula program. The AIM Doula program is an LA County sponsored program that offers doula services for African American moms.
Being a first-time mother is, only thing I can say is there's no manual.
Well, go ahead and get some rest, Nikki.
Thank you. Thank you. I'll be back.
Okay. Doulas provide emotional support, educational support, and physical comfort. This program is all about teaching African American mothers about birth, telling them their rights, their choices in the hospital, and just making sure that they have better outcomes.
I am 36 weeks pregnant, so I am in my 9th month. This is my 2nd pregnancy, and having the doula, Lorna, has been a big help. There was things that I kind of just winged the first time and kind of went with whatever I was told or read or whatever. But this time I've actually been researching things that I've learned from our sessions with Lorna. It has empowered me, especially going to the doctor when they say things, I'm kind of like, okay, yeah, I already knew that.
The statistics show that in Los Angeles County, the Black infant and maternal mortality rate is disproportionately different than the other racial groups. Black infants are dying at a higher rate, and Black birthing persons are dying at a higher rate because of racism and the physiological toll it takes on Black birthing bodies. And so with the AIM Prevention Initiative, which is the African American Infant and Maternal Mortality Prevention Initiative, our goal is to reduce that rate by 30%, and it's a Los Angeles County priority. And we do so by providing doula services for free.
Babies have reflexes, so what you want to do is bring your nipple to the top of her nose and down so you can engage a gape.
Okay.
When African American women sign up, what they get is 3 prenatals, continuous labor support, and 3 postpartums. Prenatal is mostly education and infant feeding and infant care. Postpartum is mainly infant care done by me while mom rests. We're done. It's okay. It's all right.
If I reached out to Lorna, she was able to give me either some kind of advice, or she was able to
send me to someone who did have advice, because she's dealt with so many different babies and so many different pregnancies that she's able to give me advice, and I trust her advice.
How are you? How are you? I see how much of a difference it means to these women, especially first-time parents. All of the ligaments loosen up for baby to come down easily. And even though it's helping the baby, it hurts her. So when we help relieve that pressure, it feels good.
I love the information and the research-based information that's provided by Lorna. I think it brings us together more, just to love and support one another and be there for each other throughout the process.
Over 80% of our clients report that having their doula reduce their stress levels during pregnancy, labor, and delivery, as well as 95% have had an overall satisfaction with their doula and their doula services.
Things aren't just happening to my clients. They know their choices. Everybody deserves that up close and personal support, beginning, during, and the end.
When you have someone that is invested, but also still not in your family or not as close to you, they're kind of like a third party, but they're still invested in your health. That's something that you can't buy. So I was really very, very, very grateful. It was kind of the best thing that ever happened to me.
Thank you, Anna. And I just love that video. It just really, our presentations don't do it as much justice as the hearing from doulas and hearing from the clients. So definitely want to share that, and we'll be able to follow up in the email with all the material shared today. But we also want to center that we are not the only doula program or resources in Los Angeles County. So we want to highlight them here. We have our partners, our sisters in this work, really at the and advocating for the doula benefit to be accessible to all folks that are eligible. So we have Beauty for Ashes, Birth Workers of Color, Frontline Doulas, SBCC Community Doulas, Joy in Birthing Foundation, A Walk with Mamas, and then our larger Doula Association for Southern California. Slide.
All right. So Ashley gets to do the lovey feel good stuff, and I'm here to talk about the numbers. How do we get paid for this? That's how we share the work. So this next portion is about the Medi-Cal doula benefit, and then we're gonna ask you if you have any questions and ask you to play along with us a little bit. So it sounds like some of you are familiar with the Medi-Cal doula benefit, but not all of you. So as of January 1st of this year, 2023, doula services, as described in that video, are now a Medi-Cal paid benefit. So all of your clients who are Medi-Cal members and are pregnant have access to doula services. So the benefit includes full spectrum doula care, which Ashley described as doula support for any pregnancy outcome. So prenatal through postpartum if somebody is having a baby, for any kind of termination or miscarriage as well. Right now, the benefit is for 9 visits with your doula that the member can use across the prenatal period and through to 12 months postpartum. It also includes labor and delivery support. And that's sometimes that's the thing people know most about doula support that you actually don't even see in the video. And that I think a lot of home visitors want to know that their client will not be alone in labor. So the benefit does cover delivery in any setting, hospital, birth center, home. the doula can be there. And then if the client or the doula determines that they need a few more visits, they can request an additional 9 visits and get a provider to sign off on that. The visits can be in person or virtual. And we are trying to remove as many barriers as possible for clients to access doula services. So it used to be that a provider had to recommend doula services, but the state actually released what's called a standing order, so that now it's like the physician already prescribed doula services to any pregnant Medi-Cal member, so they can skip that step and go right to their health plan and say, I'd like a doula, and the health plan says, great. Next slide, please. So because we asked the question early if you would be interested in becoming a doula, we also wanted to highlight some of the features of doulas who fall under the Medi-Cal benefit. So you can become a Medi-Cal doula provider one of 2 ways, either training pathway or experience pathway. So you can do a training and have 3 clients and then apply to be a Medi-Cal provider. Or if you have a lot of experience already as a doula and can provide references for a certain number of clients, you may be able to go the experience pathway as well. You can apply to be a Medi-Cal provider as an individual doula or as a doula group if there are a number of you. We're waiting for the state to come out with some quality assurance. I think this might be important for all of you, and it certainly has been a question for all of the clinicians and physicians we've talked to. But how are we guaranteeing that the services are going to be good if one of my clients says, I want a doula? And so we know we're very confident in the AIM doula program services and the services of our sister programs, but we do also want to make sure that any Medi-Cal member is getting respectful care. So we're looking to the state to kind of guide us in what will be, how we will measure quality doula care. To be a Medi-Cal doula provider, you do have to demonstrate that you've done CPR, first aid training, HIPAA training, and there are a certain number of hours of continuing education required every 3 years. Next slide, please. So again, this is Medi-Cal, so this is the whole state. But in Los Angeles, this is kind of what things are looking like. So we have, this number has probably grown a little bit, 173 approved Medi-Cal providers statewide as of November, so last month, and the majority of them in Southern California, but actually surprisingly not very many in Los Angeles County. So we're really working to bump up our doula workforce in the county, considering we have so so many tens of thousands of births. We have, I believe, about over 40,000 births every year to women who are on Medi-Cal. So having enough doulas for 40,000 deliveries, that's a lot of doulas. Internally, for the AIM doula program and for many of our sister programs, we're going through the Medi-Cal provider approval process. We have received ours, and so now you have to contract with each individual health plan in Los Angeles County, do those contract negotiations to ensure that you're getting an appropriate rate and signing up for whatever administrative burden you're willing to take on as a doula with each of the plans. Because so much of this Medi-Cal language is brand new to doulas and thinking about billing like it's all very, very new, we are preparing a doula hub. So there will be like a resource center for doulas or those of you who are interested in becoming doulas, so we can support you through finding trainings, maybe even finding clients, through to reviewing your contracts with the plans, ensuring that you're able to enroll in Medi-Cal, figuring out your billing, and there will also be a communications component to that where we are letting Medi-Cal members know this service is available to you. The doula workforce is here. So both supporting the doula workforce and the members themselves. Next slide, please. So we wanted to talk you through some of the talking points that we thought might be helpful with your clients, and then ask you to practice with us. Ashley, did you want to do these and then I'll lead the practice, or?
Yeah, so we have a few talking points here. One that we really find important is doula support is complementary to home visiting services. Can you hear me? Yeah.
It's a little funky.
Okay. Do you want to hear me?
Oh, I didn't even understand that one.
Do you want to
I'll do it. Okay, all right. I'm sorry, y'all. So these are just to practice along with us. So if your clients have heard about doulas but don't really understand, or are worried that they might have to choose between you and doula, here are some things that you can say. So yes, doula support is complementary to home visiting services. Doulas are professional childbirth helpers. Doulas provide continuous emotional, informational, and physical support throughout your birth experience, and this can also be throughout your pregnancy experience for those who are not going through to birth. Doulas can support your immediate postpartum needs, as we saw with Lorna in the video. Doulas can help you identify your birth values to prepare you more confidently for the type of birth experience that feels right for you. And doulas are committed to the satisfaction in your birth and immediate postpartum experience. So if anybody is brave enough and would like to practice either one of these or what you already do say to your clients about doula care, we won't do it for long, just a minute, to hear how some of you talk about doulas to your clients. You can also just practice these quietly to yourself if you prefer. All right, well, we'll get somebody brave soon enough. You can go to the next slide, please. So these are a few talking points for the Medi-Cal doula benefit specifically. So you have the talking points about doula services, and you might have clients who are not on Medi-Cal, and there are different ways you can help them navigate finding a doula. There are programs like the AIM Doula program where there isn't a requirement of Medi-Cal and the services are still free. Other programs work on a sliding scale. Some individual doulas do charge, a living rate for themselves. So depending on where your clients fall, there are a range of services available to them. So all of those doula points you can use with anybody. For Medi-Cal member clients, here are a few things you can also say. Hooray, Medi-Cal has added doula support as a covered benefit. Now that you know what a doula is, isn't it amazing that you can also get it through your health plan? Doula services are covered by your insurance as soon as you are pregnant and until your baby is 1 year old. Your insurance can help you find a doula. Contact your insurance plan to find a doula in their network. So let's also give a little bit of time here to practice any of those or anything you already say to your clients that you'd recommend other people use. Ashley and I are not afraid of awkward silences. So we hope that you're practicing over there. All right. Next slide, please. So the critical piece is that you will have to route your clients who are Medi-Cal members to their health plan. And unfortunately, we have so many health plans in LA County. So it does get a little tricky to make sure that you're routing your client to the right person. Here is the contact information that we've been given so far that gets you as close as possible to the direct contact for the doula benefit. Some of these are just the basic numbers, client calls, or you could probably call on behalf of your client and say, we're interested in doula services. So once the health plan approves, you have overcome the first challenge. Then it's matching your client with a doula. And so if the client comes in saying, I've already found my doula, this is the person I want, you do have to know that doula has to be an approved Medi-Cal provider already for the health plan to accept. If the client finds somebody who's outside of the health plan's network, there might have to be additional paperwork done first, or unfortunately, it might be a no-go. But each of the plans will have a list of doulas in their network. And I'll share, I think actually it might be the next slide. Yes, there is a directory that is statewide from the California Department of Healthcare Services that lists all Medi-Cal approved doulas. So you can also route your clients to this list, and they can kind of screen and call a few or a few dozen and find somebody who meets their needs. There are also a couple of other directories that will be, or System Midwife is already available nationwide, and Frontline Doula directory is local LA County, and that directory is supposed to be up and running early in the new year, so we can share that with you as soon as it's live. Next slide, please. So, this is just, I know we're almost out of time, so I want to open it up for question and answer, but as Ashley said, in AIM, we're looking to grow the village of support. I see some of the chat, the Medi-Cal benefit is for all Medi-Cal members, regardless of race. But Ashley and I come from the AIM program, and so that's kind of our lens, but we're looking to grow the village of support for all families through communication, connection, and collaboration between our programs. So let's do a little Q&A, and then we'll make sure that there's enough time for the evaluation as well. Apologies for our challenging communication this hour. So I think we can both have people come off mute if you'd like to ask a question, or Laurel or anybody else, if you're willing to read the questions from the chat. We'll get to as many of them as possible.
Sure, I can help moderate those. There's a couple questions that have come through in the chat. I think these have been answered, but I'll repeat them just in case. Tamara asked, what if you or your client does not have Medi-Cal benefits?
Yes, so as I said, there are a number of programs that serve folks who do not have Medi-Cal, and some of them might be on a sliding scale, so whatever your client can pay, and then there are kind of full pay programs and individual doulas as well.
Great, thank you so much, Helen. Another question that came through, thank you, Catherine, for answering it in the chat, but I'll repeat it anyway. So just to clarify, this Medi-Cal doula benefit is different from the AIM doula benefit, meaning it is for all races. Is that correct?
Yes. Correct. So the AIM doula program is a program in LA County doing direct service. It's not a Medi-Cal benefit in and of itself. And then the Medi-Cal benefit is for all Medicaid, Medi-Cal beneficiaries in California.
Perfect. Thank you so much for clarifying that. I hope that helps answer your question, Elizabeth. And then the final question, oh, sorry, I have a couple more. Jesse asked, do doulas support teens who are pregnant? Ashley answered with a resounding yes. A little bit. Maybe try talking one more time for us. Well, thank you for answering the question in the chat.
Ashley the robot.
I know. I'm so sorry, Ashley. Oh, and then one more just came through. Jeree asked, can someone have access to a doula if they are trying to get pregnant and not currently carrying yet? It's a really good question.
That is a good question. So for the Medi-Cal doula benefit, you have to be pregnant to qualify for the services. So for it to be something that is, free and reimbursable to the doula, no, you'd have to be pregnant already. I do think that there are private doulas who help with fertility. So that service would be available private. I got a question directly to me, which was, can someone have a doula and see an OB as well? Absolutely. And the majority of doula clients will have an OB. Some decide to have a midwife, but there absolutely is supposed to be a clinical provider with the doula, because the doula does not, as Ashley described, the doula is top waist up. So there has to be someone there to guide that baby out.
And oh, we got a couple more questions. Thank you so much, guys, for asking these really great questions. Michelle asked, how many weeks is a person eligible for a doula? Michelle, are you referring to how many weeks pregnant a person is, or like the time that they can receive services? Yes, okay. So how many weeks pregnant is a person eligible to receive doula services?
So there isn't a cutoff for the Medi-Cal doula benefit or for most programs. So for the AIM doula program, for example, we encourage folks to enroll as early in pregnancy as possible, especially since one of our goals is to reduce preterm birth. So we're looking to do that stress reduction and support as early on as possible to improve the likelihood of a healthy full-term birth, or baby, I should say. For Medi-Cal, similarly, you can enroll as early in pregnancy as you desire, but you are limited to those 9 visits. So you would space those out as you see fit, or your doula sees fit, over your pregnancy and postpartum, with that opportunity to have an additional 9 visits if you can say, I'm not done yet, I need more support.
Thank you so much. We have 2 more questions, and then we'll get to our evaluation. So Tamara asked, can doulas come to all hospitals in LA County?
Yes, and I so wish Ashley could answer this. During COVID, things did get trickier, and some hospitals have greater restrictions about how many visitors can accompany a patient during labor and delivery, but the standard is 2. So you can usually have your partner and your doula, your mother and your doula, a friend and your doula. That's kind of the standard across LA. Did I get that right, Ashley? Okay.
Good job. All right. And then our final question in the chat, Alicia asks, who makes the referral, and do you have to have certain risks to get one?
No, again, a great question. So again, and at this point, a referral really isn't necessary. Your clients can call their Medi-Cal health plan, LA Care, HealthNet, whatever it may be, and say, I'm pregnant and I would like a doula. And there shouldn't be any barriers to receiving doula support. Do you have to have certain risks? No, you can have a healthy pregnancy and request the services of a doula.
Great. These are all really great questions, y'all. Thank you so much for participating and picking the brains of our presenters here. So we'll thank you, Anna, for putting up our SurveyMonkey evaluation. This survey will just take you a few minutes to complete, and it's really, really helpful for my team here at LEBBN and also for our presenters from DPH. And while you guys are all completing the eval, I would like to just share on behalf of LABBN and the consortium. Thank you so very much to Helen and Ashley. This is a topic that has come up many times as something that home visitors want more information on, and you really presented it in a very understandable way. We will be sharing several resources in a follow-up email after this presentation. I think that was great. Thank you so much. Helen and Ashley, do you have anything that you would like to add before we adjourn for the day?
Just that we welcome additional questions that pop into your head after the fact. We're here. I think both of our emails are in the chat, but also in the deck. So feel free to reach out about doulas or other services that the Division of Maternal, Child, and Adolescent Health can provide. Thank you for all you do. Home visiting is near and dear to our hearts.
Not sure, Ashley, if you wanted to try to add. No, you're good. Okay. It was tough today, but you persevered. Thank you all so much. Is anyone having trouble accessing the survey? We're doing okay there? Great. Well, thank you once again. This was such a great turnout, great webinar, and keep your eyes open for our follow-up email. Thank you so much, and I hope you all have a wonderful, wonderful holiday season.
Thank you.
Thanks.
Laurel, thank you, Anna.
Thank you so much, you guys. You did
Thank
great.
you, guys.
Yeah. You guys did great. All of you.
Thanks for your questions, Tamara.
You're welcome.
Yeah, if we could turn those into an FAQ maybe or something and type up the answers.
That's a
We're
really
really
good
good.
idea. I can work on that.
Yeah, we'll save the chat. And Lita, I just saw your question in the chat. Hi. Helen, I don't know if you have just one more minute to answer Lita's question, but she's asking, when there's a demise, what type of help do you give, and what kind of, or are there mental health referrals that can be made?
Ashley, you're going off mute. Let's try it.
I'm talking.
Yeah, we can hear you. You're just a little bit robotic.
Oh, okay. Yes, we do provide grief and loss support and resources, as well as postpartum support as well, doula support, because it's still that recovery. And then connection to therapy. If you all have additional resources, yeah.
We can include your question in the FAQs, Lita, and we'll make sure to send that out to everyone.
But the short answer is the doula can be there.
Thank you.
Thanks all. Thanks for having us.
Great
Take
job,
care.
guys. Thank you so much. Have a good day.
Happy holidays.
You too. That was wonderful. All right. Bye, everyone. Bye. Good work, policy team.